just finish the session now. Andrew Robertson, he's a Senior Inspector from WorkSafe Tasmania, and he's here to give us a few points from the Inspectorate.
Thank you, Pam, and good afternoon, everyone. As an inspector over the last 7 years or so, I've asked a lot of questions in a lot of workplaces, and today for a change I'll ask a question, discuss it and hopefully answer it for myself. That question is, what is the most common cause of a workplace incident? One of my favourite parts of the job is getting to look closely at all manner of circumstances in workplaces, either during a site visit initiated by us or in response to an incident which is certainly less favourably. Over the years I've reviewed causations for hundreds of incidents and what control measures are put in place to prevent a similar incident occurring. Incident reports generally use words like human error or inattention, which cover a broad range of circumstances like safety directions not being followed or made available, rushing and corner cutting, inadequate risk assessment, stress, that list goes on. Human error being given as a causation of an incident often attracts control measures to prevent it happening again, such as retraining, increased supervision, updated procedures, and team awareness sessions. These and similar controls generally make weight on a reasonably practical scale. But having seen them come up so many times over the years, I started to question, what is the next step to reduce incident rates further? Now, in some cases, incident investigations do result in excellent elimination, substitution, or engineering controls being developed and implemented. Look no further than our WorkSafe award entry pools to see some great examples. But technology still appears to be ways off replacing humans totally in the workplace. This next step requires us to look more closely at the causation of human error in workplace incidents. In my observation, it comes down to the quality of attention of a person or a group of people. Whether designing, implementing, or carrying out work, a person's quality of attention is fundamental to working safely. So what do I mean by quality of attention in this context? Let's say, for example, I'm an extended care assistant working in a nursing home. I find many of the residents emotionally fatiguing to interact with, as are some of my colleagues. I feel rushed in my duties. I don't get much of a chance to care for the residents more, so I process them. Sometimes cutting corners with safety here and there to save time, or avoid working with a colleague I don't trust or get along with. I have a lot going on with my own family, and so I find it hard to commit spare time to doing the things I enjoy and I know are good for me. My quality of attention could be described as intermittent, as I feel so strung out, burdened and stressed. I spend most of my days at work with this either as the forefront or background of my experience. It's now become the usual way I am outside of work. I tended to be like this a bit before I started with this job, but now it's much worse. I try to either block it out or talk it out, but neither leaves me feeling any better about it. Can anyone here relate to this, either in another or themselves, perhaps? Yeah. For some, it only takes a few months of enduring these types of inner and outer circumstances before something in the body or mind breaks down. Having met and spoken with thousands of people in workplaces, I've directly observed that many are conducting themselves in this way to some degree. So is the workplace to blame or the worker? I see it as both, as in we both bring limitations to the table. Working conditions across all industries, especially healthcare and social assistance, in my view, needs a lot more work done in reversing, or at least pausing, this phenomenon of progressively doing more with less. And by the same token, it's imperative, if we want to see a reduction in workplace injuries and diseases, that workers are encouraged and increasingly self-motivated to progressively enhance their quality of attention. The so-called limitations of humans is in part the unpredictability of our responses, where there are potentially thousands of factors involved. But for those of you who work in this industry, you know that it is your very humanness that makes you superior and irreplaceable over technology in providing care and support. When our quality of attention is engaged, your ability to respond safely is second to none. But when we are so used to feeling numb, disengaged and disempowered, then we can end up somewhere on a piece of paper being classed as a human error. The drive on both sides for making the change from a legislative view is Section 28 of the Work Health and Safety Act, where it states to the effect a worker must take reasonable care of their own health and safety, take reasonable care that their acts or omissions do not adversely affect the health and safety of others, and to follow all reasonable safety directions. So is it reasonable that a worker is required to create and maintain a pleasant atmosphere in them to ensure they are conducting themselves with a favourable quality of attention? Well, no, it's not. Not unless it comes through being engaged, educated and enabled to become that way. What I envisage is for employers to progressively develop or engage service providers to set up programs that increase and sustain a quality of attention in both the individual and collectively as a culture. Being involved in these programs would be a mandatory safety direction to enable the worker to satisfy their duty under the Act, and as with all safety controls, the program will be provided by the employer. Workplaces are made up of the individuals within them. Therefore, the programs need to be targeted at this level. And this is an industry which usually attracts individuals who already have a strong intrinsic desire to care for their fellow human beings. So programs that aim to revitalise, maintain and give momentum to this way of being, which enables us to have that quality of attention, where we as individuals feel empowered, enabled and engaged, are what I see as the future. A workplace full of workers all making individualised progress that feeds positively into the broader culture would be a distinct contrast to many of the workplace cultures I come across. Workplace health and wellbeing programs currently demonstrate themselves to be an investment of every dollar spent returning between $3 to $6 in worker output. Programs that focus on building and sustaining an individual's quality of attention have the potential to provide even greater returns for business and society at large. So what is WorkSafe's role as a more progressive, as a more responsive regulator in making this change to engage, educate and enable the healthcare and social industry? Well, late last year I began developing a program for WorkSafe Tasmania to engage the healthcare and social assistance industry with the aim of further reducing incident rates. The program is scheduled for a team of 6 inspectors, 2 in each region, to attend every healthcare and social assistance workplace, excluding private residences, over the next 2 years. The workplace inspections will focus on 5 key issues that were established through industry survey and statistical analysis. They are workplace culture, workplace stress, that covers areas including client factors, colleagues and work procedures, capacity or fitness for work, safety procedures not being followed, and inadequate incident investigations. Now, this will involve confidential discussions with up to 20% of workforce and management, workplace presentations providing unified feedback towards embracing opportunities to eliminate or control key issues, and also request feedback from workplaces on the value of interactions and the ways we can improve them. So I hope to see many of you again in the coming months during a workplace visit. In the light, we're there to engage and enable you and your entire workplace to bring back that quality of attention to your work and maybe even your whole life. Until then, I hope that you'll find ways and means of improving your own quality of attention and that others will be inspired to do the same. All right, thank you.